The Inner Voice Show. On this episode, we're going to talk about relationship, finances, and a whole lot more. So stay tuned. Hi, I'm Dr. Foojan Zeine. I'm a psychotherapist. I'm an author and an international speaker. I have hosted my own television show, Inner Voice, in a satellite program for 16 years. Whether it's premarital counseling or through their marriage, how to deal with children, and if they're going through a divorce, to teach them how to communicate better together. In actuality, I think my job is very important to work with individuals and the couples in order to make the most important relationship of their life healthy, which makes them healthy. On my Inner Voice show, I actually interview some of the prominent psychologists and entertainers in English, and I also speak to some of the psychotherapists who are Iranians and the artists who are Iranians, and I speak in Persian to the Persian population around the world, from Iran or Europe or Japan, Australia, all over the United States and Canada, because obviously I was born in Iran.
Where's Dr. Zeine? Dr. Zeine?
Hello.
You also have been trained in my specific methodology and techniques, correct?
Yes.
Are you willing to talk to her after this show?
Absolutely.
And tell her the step-by-step that she needs to do to deal with what I believe is an addictive personality?
Yes, absolutely.
The family goes through a lot. For boys who are becoming girls, the fathers of the family suffer. They will keep being confused. They look at all the childhood pictures that they've took of their son, and now they look at somebody who's standing in front of them and supposed to be their daughter. Coming up, I'm going to be talking to a psychotherapist about awareness integration model. You really want to know what that is, huh? Coming up. Stay tuned. Hi, I'm Dr. Foojan Zeine, psychotherapist, and I'm here with Nasreen Bafordari, licensed marriage and family therapist. We're going to talk about awareness integration model, a psychological model that I have originated, and Nasreen Bafordari is one of the first therapists who has actually learned and has been utilizing it with her clients. Thank you for coming.
Thank you for inviting me. This is an honor.
Some of the major topics that I actually talk to my clients who are couples are first talking about sexuality. Many people don't know how to talk about sex. Concept of communication about it is something that I actually have to teach the couples and how to do. We talk about sexuality. Many people come into their sexuality in a very automatic way. We can go through the whole experience and wham, have a great time, but being with another human being, it actually takes skills. So becoming aware of every area of how we think, how we behave, how we feel, how we communicate with another human being in order to have an amazing sexuality is part of what we also teach in this AI model.
So much of our sexuality.
People don't talk about finances a lot. They don't have a system. They come from two backgrounds of how they actually have created their finances, and I have to help them create a system and have a great communication in how to follow the system. Another main topic is when they actually have children. Now remember, two people, two backgrounds, two cultures, two sets of values are coming in, and now they actually have to bring those together, and that's where they need how to communicate, be flexible, and really negotiate on one way of handling their kids. Duet, sometimes you guys are entering each other's space and singing together, and then solo. How does that experience for you?
The funny thing is,
in-laws, we have to deal with them. They're always there. They're going to be there. We didn't marry them, but they came with a package. So somehow we have to really, really work with them. And if I have to actually add one more topic that I've had to deal with a lot of couples and individuals is addiction. Whether it's an addiction to alcohol or drugs, pornography, cell phone, computers is one aspect that really, really affects the person's life and in their relationship. With people who are going through recovery from addiction, they've had some sort of a trauma in their childhood. And when we've worked with the awareness integration model with them, clearing the trauma, the choice and the chance for them to relapsing is really minimized. I have been in the field of psychology for about 25 years. I started with seminars in ontology and psychology almost the same time. And I know you were part of the pilot study that we did, and in the result of that pilot study was that people were actually minimizing the depression 76%. They were minimizing anxiety 64%, and their self-esteem was rising about 43%. Now those are astonishing numbers.
You know, I wanted to go through it. I wanted to experience what my client would experience. So I asked you to work on me as a model for the group that was being trained.
Hey everyone, thanks for watching. If you like what you see, you can see more on my website and my YouTube channel. And if you want to contact me, I'm on Facebook and Twitter. Bye-bye. Hello and welcome. I'm Dr. Foojan Zeine, and welcome to the Inner Voice Show. This is a show about what's important to you and everything that is important to you. We're going to talk to experts from the psychology field and all the fields. However, we do look at things that are important to you from a psychological view. Now, for people and experts that I spoke with, if you would like to get a glimpse of that, go ahead to the YouTube channel that you see on the screen and see the interviews with masters of psychology. Now today I'm really excited to have my guest. I'm going to interview with Mr. Joe Dowling. He is in Philadelphia. He's a licensed professional counselor. He's been an Ericksonian therapist for 22 years, and he has a new concept called Zonefulness. Hello and welcome, Mr. Dowling.
Hi, Foojan. It's great to be here. Thanks for having me this evening.
Of course, and I know that I met you last year in December in a conference, brief therapy conference, Ericksonian brief therapy conference, and I invited you to be on my show because you not only work with families, couples, and individuals, but especially with people who are in sports and sports performance. And you have developed a new concept that really not only works for them, although it really works for them, but you can take the same concepts and bring them into life and all matters of life that you can bring. But before we go to the Zonefulness, you are an Ericksonian therapist. So please tell my audience, what is an Ericksonian therapist and what is an Ericksonian therapy?
Well, an Ericksonian therapist is someone who specializes through the teachings of Milton H. Erickson, MD. And I teach a 100-hour training program on Dr. Erickson, so I'll keep it brief. But Dr. Erickson is he's the father of modern medical and clinical hypnosis. Streams of therapy that emanate from Dr. Erickson are solution-focused, solution-oriented therapy, of course, hypnotic therapy, NLP, the mind-body therapy. Recently, the self-relations therapy from Stephen Gilligan, a prominent Ericksonian therapist.
Yes.
So, in essence, it's a strength-based, future-focused therapy that is extraordinarily experiential. So, Dr. Erickson was fond of saying that the conscious thinking mind doesn't do much of anything of that much significance, while your subconscious mind is an infinite storehouse of dreams, learnings, potentials, possibilities. So I frequently describe to my clients initially that in the therapy that we're embarking upon, that I won't just be explaining things, I will be taking them to really interesting places. For example, I tell people that I was in Hawaii recently with my wife, and I could give you a PowerPoint on Hawaii and tell you stories about Hawaii, but you really wouldn't understand Hawaii until you got off the plane in Maui and you experienced it for a week. And that's what Ericksonian therapy is. It is an experience where your subconscious mind can create change.
So it is hypnosis. So not only works with the subconscious, but it has different techniques that allows you as the therapist to take the clients to their subconscious and deal with the subconscious and work and talk with the subconscious, and then from there to create whether it's transformation or shift or a behavioral change or a dynamic change from an internal perspective. And then you have taken that and you have added different aspect of mindfulness and different techniques where that has changed into what you have called a zonefulness concept. And you are writing a book about it that hopefully will be out by the end of this year. And say a little bit about your technique and what you have brought near and close to Ericksonian, which together have created something completely new.
Well, yes. The book hopefully will be published this year, and the title is Zonefullness, the Ultimate Guide for Student Athletes. I love working with artists and athletes and performance therapy. So in searching for a title to the book, I had the classic aha experience where it hit me one day that I could call it Zonefullness. And the zone, of course, is a focused, absorbed state of attention that people go into when they're reading or engaging in athletic or artistic events and maybe just daydreaming. So the zone is what people look for when they're trying to achieve at a maximum level in athletics.
Now, what came up for me is I've done a lot of hypnosis also these past 20 years, and when you were talking about a zone space where you are ultra focused, I also have the same experience with hypnosis. It's almost like hypnosis is also ultra focused. I know a lot of people maybe that are watching us and our viewers have probably looked at hypnosis as something like an altered state, as if you're not there, because many people have experienced hypnosis because they went to a Las Vegas show and somebody was barking like a dog and they figured, oh, that's hypnosis, where it really isn't. And it's really also an ultimate space of focus and attention. Is just, where we got the attention. So you got two different aspects. One is being in the zone and one is the hypnotic state, which both are very focused attention, right?
Absolutely, that's exactly it. Dr. Erickson talked about the naturalistic trance that people go into walking through their life, just absorbing themselves into things, and that's what athletes do in their zone. So from an Ericksonian perspective, the trance, the hypnosis, the zone lives inside of each person. So zonefulness is really just a nice way to talk about the hypnotic state, which is really natural. And as you know, Foojan, hypnosis has a horrible reputation, unfortunately, and I spend a lot of time demystifying hypnosis with clients, and now I simply call the trance the zone. And I'll still use the word trance, but I like to say now we're going to go into the zone. So zonefulness is this integration of mindfulness meditation, hypnotic zone exercises, and positive psychology. The mindfulness meditation is very popular today. They're teaching it at financial graduate programs. They're teaching it in professional sports and in the arts. So it's accepted in society, whereas hypnosis still has a bit of a stigma. So I wanted to bring them together and incorporate that mindfulness state of peace and stillness, along with the hypnosis, which I label as zone exercises with my clients. So with the hypnotic zone exercises, we can really control. It's like as if we're using the control knobs of perception and sensation and we can incorporate the hypnotic phenomena. For example, I use age regression, but call it personal history of success, to help magnify someone's history of really playing at their best, being at their best. And then the flip is future memories of success, which is the hypnotic phenomenon of future progression. So really trying to normalize hypnosis and the trance as a zone state, which accelerates peak performance and allows people to maintain peak performance.
So I'm hearing a lot of strength-based, also positive psychology, where you're utilizing, many times we've utilized, and I still do in my practice, and I'm sure you do when it's necessary, that we go into the past and take what maybe the traumas or the place that the person was vulnerable or fragile or was in some sense traumatized or very, very in a vulnerable stage, and we take those and maybe bridge them with their strength part. And what I'm hearing in your experience and what you're doing in your model and concept is that you're really going into the past strength points and not just the vulnerabilities, but in actuality to where the strengths were in the past, and with all of the positive emotions that was there, and maybe the physical memories that were there, and then you're also bridging them with a future that is being created through those strengths, as if you're letting the subconscious mind of a person know that that's the path they're just going to take. Whatever greatness they've had, that's the path they're just going to continue that greatness and create great results. Is that what I'm hearing?
Precisely. That was a beautiful explanation of the zone exercises, of the hypnotic journey, where people can revivify and remagnify their personal history of really being at their best. One of my favorite expressions is your best self, and helping people reconnect with their best self. And with that being said, of course, we're certainly never minimizing or ignoring the problems and the difficulties. We'll process that as we need to, but we will certainly magnify a person's history of strength and resiliency and being at their very best. And of course, that shifts in. The really nice shift is now let's imagine. Milton Erickson said anyone can imagine anything, and now let's begin to change the brain chemistry and have people anticipate success and experience the future as if it were now. Yes.
And when they're experiencing the future now, in what way do they also deal with maybe performance anxieties or different types of obstacles, fear of failure, or something that they're really not great at and they need to create skills? How do you in your model go about doing that?
Yes, well, that's the essence of positive psychology, more specifically the solution-oriented approach popularized by Bill O'Hanlon, where, and of course, streaming from Erickson's extraordinary influence, where the problem becomes the solution. And I tell my clients, you're going to know this therapy is working for you when your symptoms, your problems, the anxieties become positive triggers to use your tools, to go into your zone, to become extremely, extraordinarily self-supportive, to imagine your past history, your future history of success. So problems become solutions. And the zone exercises, the hypnotic element of zonefulness, that really allows this nice idea of problems becoming solutions to really unfold and to be actualized by people. So it's that experiential piece that allows the conscious cognitive piece to really work. So, my specialty over the last 20 years has been anxiety and working with I call my clients how to become smart enough to know when to stop thinking crowd. A lot of high-functioning people who overthink and worry. And of course, we see that in sports and performance all the time. So the mantra is, thank you, anxiety, for reminding me to take a deep breath, to experience a power zone. A power zone is simply 30 seconds or 1 minute where you take 5 deep breaths and imagine yourself in the future, or become extraordinarily self-supportive. So yeah, in summary, we're taking these principles of problems becoming powerful cues, positive triggers, and we're integrating that into the approach. So we want people to meet their anxiety, utilize it, and then move forward.
So when you look at taking the same concept and beyond the performance in the sports, if they were going to bring it to regular issues of their life, which they might have anxiety over, or they might be depressed about, or they don't know how to work with it and they're very, very frustrated, how do we take the same concept that you were talking about and bringing it in that? Do you do exactly the same thing where you go and see, for example, if somebody had a particular strength in doing something successful and then bridging the same skills, or if they've never done anything before and they don't know if they have the skills or the strength in that, do you find other areas of their life in the past that they have utilized strength similar to this and then somehow bridge it and bring it part of the positive self-talk?
Absolutely. And ultimately, very rapidly, working with athletes and performers, this becomes game-of-life therapy. And it's funny that my athletes think this is a special model just for them. Well, it is just for them, but it's also what I do with all of my clients. And to your point, everyone has a history of success. And Dr. Erickson talked about one of his interventions was called the early learning set, and that is going back to when people learn to walk and they learn to read and learn the letters of the alphabet and how to talk. And when you really look closely at that, they're extraordinary accomplishments.
Now, when go ahead. No, go ahead.
What human beings are able to accomplish throughout the life cycle, and it may be an achievement in a relationship, an achievement at school. It can really be anything. So when we look closely, someone's personal history of learning, of achieving, typically we can find so much. Now, the classic anxiety symptom, part of my model is the toxic 3 of poor performance, or the toxic 3 of anxiety, and at the top of the triangle is self-criticism, right? And it's almost impossible to find someone who isn't criticizing themselves, or the other part is the what-ifing. So we have self-criticizing, what-ifing, and we have what I call whining, people who ask why all the time. They're focusing on the negatives of the past. Why did I do this? Why did that happen to me? So I don't want my clients to be whiners. I want them to notice when they're asking why and say, what can I do differently?
I like what you said about what-ifing. That's a nice word, what-ifing. Joe, as you were saying, this came up for me that many times depressed people or people who have very low self-esteem, and because of that, they have been depressed, or maybe low chronic depression and not maybe major depression, but definitely both low chronic dysthymia or major depression. They don't know how to look at the strengths, as if they've never done anything that's great, or everything about them has been bad. So even when we're taking them to this land of the past and they're looking at different aspects of it, where maybe you and I are sitting there and saying, wow, that was such a great achievement, or you've done this and you've got the skills, they look at it and consistently say, no, that just wasn't anything. So many people did it better than me. That's just nothing. I'm bad and I'm not good enough. And they insist. They very much insist on it. So with people who are depressed, how do you do this model with them?
Well, that's a classic example of the conscious mind. That is, I like to think about the conscious mind as a one-channel television where every program is negative and worrisome and anxiety-riddled. So a classic component of an Ericksonian approach is the one-step removed concept. And I'll typically ask clients, if there was a movie of your life, who would play you in the movie? What actress, what actor would play you in the movie? And I'll say, let's pretend you're not you, you're just someone watching this movie. What would you want the person in the movie to do? So the actor in the movie playing your very best self, what would you want her to do? And we'll have a little discussion about that. And now if that's still too difficult, we want to do some experiential work, some hypnotic, mindful work, where we can depotentiate the limitations of the conscious mind that continues to play this tape that the person's not good enough. The subconscious mind is benevolent. It has a benevolent wisdom and only knows how to help us. And now we can create a satellite dish instead of a one-channel television and facilitate the person experiencing the possibility channel, the self-support channel, the potential channel. And when I present this to clients, I already know that their conscious mind is doubting what I'm saying, but that as we shift into more of an experiential piece, we'll be able to bypass those limitations, the negativity, and begin to create new ways of viewing, new ways of experiencing themselves.
So it's interesting as I hear you, by doing this, by bringing the channels, you are also detaching them from the identity that they are so adamant about having, which is the negative one, and they're holding to it, with their dear life, and you kind of softly detach it, and oh, look at this, like if this actor or actress was playing your life story, and then suddenly the person becomes detached from what they were calling a life story through this imaginative play that they're going to do. They're going to have fun and play now with this rather than being in the dumps. And then there's more fun and play about coming up with new channels and coming up with the creativity of all of those channels. And then there's an essence of, if you're detached from one solid identity that you really insisted on, maybe you can play around with other identities, and the one that you're choosing kind of takes you to the future.
Absolutely, that was so well spoken, and it's this connection, this experiential piece that's extremely safe and secure within the therapeutic relationship, and it's such a rapport builder with your client to guide them into the safety and security of their subconscious mind. And what I really like to magnify is that everyone's best self lives on the inside. You were speaking, Foojan, about the symptom self. Right? The symptoms is, I conceptualize symptoms in the conscious mind as badgering people with the same rhetoric all the time. But the conscious mind is very small, it's very finite, and now the subconscious mind can dissolve those symptoms. It can first utilize them as a positive trigger to create new channels, to be extraordinarily self-supportive. And until you can do it for yourself, of course, you can watch the movie. I had a client come in recently. I hadn't seen him for a couple weeks, and he sat down on the couch in my office, and he put his hands behind his head and he said, "George Clooney had a great mom." And he told me each morning he got up, he did his self-hypnosis, I call it self-zone, and he imagined George Clooney walking through his day as him. Wow. And he was able to do things differently, reconnect with his wife and his two daughters, and it was really an interesting conversation. He had a big smile on his face, and it really allowed him to become unstuck in that self-image.
That's interesting, because as you were saying that, what came up for me is that when you see somebody else playing you, or you see yourself as them, that ultimately, as you said, your best self is going to come through, and then the notion of act as if, and then when you act as if long enough, then it becomes you, and at least you know that you have that skill. If it came from you and your imagination, and you're the one who's writing the whole story, that it must have come from a very skillful place in you that has created that. So that must be also yours. And then from there, even if you couldn't at the beginning put your own face to it, but if you put George Clooney or someone who you admire on it, then that part of you that can also admire you. And I love the way you said the badgering voice that comes in and badgers you. It's like now you might also create this admiration and admiring voice that comes in and really does admire you, and you feel confident looking at yourself as George Clooney walking around, or anybody who you feel like they're the one, and suddenly you become the it and the one who's running the show. That's brilliant. That's really nice.
Exactly. And it's interesting because most people, the people that we're talking about how this issue is so incredibly common, typically they're wonderful with their friends and their loved ones, and they're compassionate and they're empathetic. And I'll ask, when do you decide to have one set of rules for yourself and another set of rules for everyone else, right? So they're connected and helpful to everyone else, but they're so self-critical of everything they do. So the acting as if, I like to amp that up a bit and talk about therapeutic pretending.
Okay.
Right? And play the part of your best self. And when you play the part of your best self, you're doing exactly what you do for the people you care about. And this profoundly, deceptively simple concept of how would you talk to a loved one who is really trying to improve, really trying to move forward? Would you badger them? Would you criticize them? Would you put them down like you do to yourself? And the answer is, of course, I wouldn't. No. So therapeutic pretending, as you said, when you start playing the part of your best self, it does start to feel right. Symptoms never feel right. It will never feel right to be self-critical and self-loathing and negative. It's just not possible for that to feel right. So yeah, trying on for size these different parts, eventually you'll realize that it's not acting if it feels so authentic and so genuine.
And the other part with your model, as I'm hearing, is because it's about a successful future. Whether it's in our life or it's in sports or wherever it is about a successful future. And it seems like the vulnerable parts of us will never create a successful future. So taking them with us, in a sense, into the future is not going to create the result that we want. So the allowance for the strong part, the strength that we have had and we're taking on, that's what guarantees a success in the future, not the vulnerable side. So it's more of how to deal with our own vulnerable side or the symptom self that you're talking about, but not necessarily intending to take them in the future. And part of the concept of anxiety, as you were talking about, is that we do take the symptom self of I can't, I'm not good enough, I'm this and I'm that into the future with us, and then we get stuck because that's not where they're supposed to be. A future is supposed to be the from our strengths, from reality of our strengths, the things we can do, the wisdom we do have, the goals we set to take us there and create a successful future for us.
Precisely, and again, really well summarized. And what I would add on to that is symptoms become very valuable because now you utilize them as positive triggers. And what happens, I like to say no one gets rid of anything. We don't get rid of our ability to be happy, our ability to be sad, our ability to be angry, our ability to have symptoms. So people will make the mistake, they're working through anxiety and they do really well for a couple months and they have a recurrence of anxiety. They believe they're right back to where they started. When that's not the case, they're just having anxiety. You can just have anxiety. But now we want to say, thank you, anxiety, for reminding me to use my tools. Thank you, anxiety, for reminding me to be, I like to have some fun and say, be psychotically self-supportive, right? Thank you for reminding me what will it be like when I achieve my goals. So the symptoms will pop up when you least expect it. There may be stressors that, of course, pop up. The symptoms try to sneak in, and now we're just saying, thank you for reminding me.
I remember listening to Ram Dass. I don't know if you or some of the audience, I'm sure that you know Ram Dass. And he was having a lecture, and he said, our neuroses are like nuclear waste. They never go anywhere. Once in a, even if you put them in deep, deep, deep earth, once in a while they'll pop up, and all you can do is to say, welcome, come here, let's have tea, and then, okay, thank you for popping up, and goodbye. And then for sure another one will pop up again.
Exactly. And then the more, Milton Erickson was the first therapist to ever incorporate humor into therapy, so having some fun with the symptoms, right? Laughing at them, being sarcastic with them, whatever. You would never advise your friends to be symptomatic. So yeah, you play with them, as you were talking about earlier.
Now,
and you have some fun with it. Yeah.
Now, when you talk about the experiential part, what do you mean by that? Like, what do you do in the experiential part? The inquiring mind wants to know.
Yes, the experiential part is really the zone, the trance, that have someone close their eyes, take 5 slow, deep breaths, and now I will guide them into a hypnotic experience, into, we'll call it now, a zoneful experience. And that's the part where it's hard to explain verbally because everyone's conscious mind is listening to me. The subconscious mind is what becomes activated in a hypnotic experience. And the subconscious mind is benevolent and only knows how to help us. And it can, I'll reiterate, revivify and magnify personal successes and launch you into the future to future successes. And that's the experience. If you were going to
explain, as you're talking about it, can you also, within this explanation, kind of explain what that hypnotic zone is experienced as? In a framework where if somebody has not gone into a hypnotic stage, they can have a frame of mind in what happens. Because I have a lot of people when they come, it's like, I never get hypnotized. And I'm like, do you drive? They're like, yes. I'm like, then you get hypnotized. But people have such a different idea about what a hypnotic state is. Or somebody comes in and says, can you hypnotize me and just let me forget this trauma? And I'm like, I can hypnotize you. You're not going to forget. I mean, in short of lobotomy, you're not going to forget anything. But so they have a different notion of what hypnosis is. So as you're explaining the zone state, can you also kind of integrate it with explaining what is that even like to be hypnotized?
Well, I'll quote Dr. Erickson yet again. He said it's harder to be socialized than hypnotized, meaning that think of infants, they're in a continuous hypnotic state. It's a focused, absorbed state of attention. That's the only way we learn things. People experience what naturalistic trance is, what hypnosis is every day of their lives multiple times, sometimes hundreds of times. It's simply when you absorb yourself, when you're locked into that novel or that movie, or you're working out, or you're doing ceramics, or whatever it is. Sometimes I talk about doing therapeutic channel surfing after a long day, where I get into my hypnotic zone just changing channels. So the problem, of course, is the word hypnosis has been vilified so unfairly. And it's the only medical and psychological tool that is so misunderstood, wildly misunderstood. So people come in thinking they're being hypnotized and something is being done to them, but really all hypnosis is self-hypnosis, and my job is to be a tour guide and take people into that place they've been countless times when they're really absorbed, really focused on something. That place sometimes you go right before you fall asleep, or when you're daydreaming on the beach. So one of the advantages of saying zonefulness is that I don't have to spend so much time demystifying hypnosis. I still talk about hypnosis. People come to see me for hypnosis, but it's really, so unfair, something that saddens me that this word has been so misconstrued in professional circles and in the general public, of course. And you were right. The best example is the driving, that highway hypnosis, where you don't know how you got from one exit to the next.
And the beauty, I think, the beauty of what you're saying is also that if when they come in to the session and they get this from you and they learn it, then they can also utilize it on their own when they are home, because it becomes part of them, and they can take it into that kind of a zone and kind of like do a self-hypnosis with themselves and train themselves into that mode. And the more they train themselves, the more that they just get better and better at this, putting themselves into that zone, which is something exactly that you're intending as their therapist and psychologist to be able to do without you when they are performing the sports that they are, or when they are there in their business or public speaking or whatever it is that they're doing, that they can make that type of zonefulness part of who they are, and call it up anytime they actually want.
Absolutely. The zone lives inside of everyone. And, I typically will make recordings for clients so they can listen to their zone recording when they're not in the office. And by listening to the zone recording, going into that place on the inside, then they can practice on their own much easier. And I'm a big proponent of very brief zones. It might be a 30-second zone. I call it the power zone, where you close your eyes, take 5 deep breaths, and just go to that place. And now there's this seamless way of being your best self, of trusting yourself. You have a little anxiety, then you take a few deep breaths, maybe do a very brief zone, normalizing that whole capacity to go inside and access the really good energy.
And how long is your process when someone comes in for the first time to see you? How long is a typical treatment module when it comes to Zonefulness?
Well, the session will be an hour, 50 minutes to an hour. And depending, the first session, if an athlete's coming in to see me, for example, what I'm doing a lot more of today, I'm going to give them a zone experience at the end of the session, just to, give them a bit of a warm-up so they're looking forward when they come back. I always tell people the worst thing that will happen is that you'll find it very interesting and relaxing. That's the worst-case scenario. And, of course, with anxiety, this is truly state-of-the-art for anxiety, and I work a lot with irritable bowel syndrome and hypertension, migraine headaches, and things that are anxiety related, and we just have extraordinary success teaching people to access the healing energies that.
Wow, that's interesting. That's interesting. I really want to hear about that. What you said was that not only for a future of successful performances, you're also now utilizing this model in kind of a medical concept of it, which if someone due to anxiety, and based on anxiety we have a lot more symptomology of physical and psychological, whether it's they have obsessive compulsive disorders or addictions or any type of ulcers or physical concepts that they have. By doing this and bringing down the anxiety, you're also healing or affecting a lot of the healing of many of the physical symptomology or illnesses, or even other mental illnesses, which is based off anxiety. Say a bit about that, and how do you tap into that self-healing mode? In what way do you do that?
Well, again, it's about doing Ericksonian hypnosis and hypnotherapy. Erickson was a physician and a scientist, and he spent so much of his time teaching physicians across the country and the world how to intervene hypnotically to heal the body, to cure the body. And it's something that it's hard to explain to the conscious mind because everyone's conscious mind is listening to me. What happens is that the subconscious mind knows how, via hypnotic interventions, via the hypnotic phenomena, attack the irritable bowel. I like to call it, we were developing pleasant bowel syndrome instead of irritable bowel syndrome. And just through all the ways of doing and facilitating hypnosis, the body heals. We know with mindfulness hypnosis that almost immediately you're going to regulate your blood pressure, your pulse, your respiration. You're in the process of strengthening your immune system. This work, of course, is just so incredibly effective with cancer patients. And it's creating this expectation of success, this visceral feeling of healing inside of you. And the same principles go with hypnobirthing, where women can have very manageable, comfortable deliveries. It's just the infinite, I know it sounds too good to be true, but the infinite capacities of the subconscious mind to heal the body and create comfort.
I remember I took Dr. Yapko's hypnosis for so many years. And before that, I've been doing hypnosis for 22 years. But after that particular class, where I saw some of the videos about how to freeze your hand, it was fascinating. So I came back in my office, and then out of the blue, this person calls me and says, I need to go and do surgery on my teeth, and I'm very allergic to all sorts of medicine, and there's no way that they can numb me with what they have because I'm going to suffocate. So they have told me that you do hypnosis, and I was wondering if you'll do hypnosis while I go through the surgery. And I'm like, what? I just saw that video, and it was interesting because we started. I said, well, I need a lot of time with you to get your body trained for this. And we started. She was able to numb her own hand. And after she numbed her hand and froze it, and then she put it on her face, and then she numbed all of her face. And then I went to her while she had almost like 12 sessions of dental work, and some of it even with some, doing surgery, minor surgeries. I'm not talking major surgery, just minor surgeries. And but it was amazing that this the dentist who was in this field for about 30 years, he was not sure about this, but he figured, I can't do anything else, might as well, if the client wants this, we'll give it to her. So I used to go for almost 20 sessions to the dentist office. We did this whole thing, about half an hour of her freezing her hand and putting it and numbing her hand and putting it on her face and numbing her face, and go through this whole thing while, as you said, we taped it and put it. And I'm telling you, if I didn't do it, if I didn't see it with my own eyes, even if you told me, I wouldn't believe this. And it was mind-blowing that although I've done hypnosis for so long, that the amazing things that your body does and is capable of doing is really mind-boggling. And then after that, I did one with as you said, the giving birth. And it's just been fascinating about what hypnosis can do when it's done applied in the appropriate way. Again, not in the Las Vegas show, but when it's applied in the right way. I don't know if you've had. Tell me a little bit about your experience as we getting close to the end of the show, about experiences with hypnosis that are so effective, and bringing the mindfulness to it. So give me a little bit of your experiences.
Well, sure. Working with habit control, and early in my career, I remember not even being through my Ericksonian training, and my homework was to find a guinea pig to help them stop smoking, and it was amazing how effective it was in a handful of sessions.
I've actually stopped smoking with hypnosis, so that's very true. Yes.
Yeah, and the way I conceptualize it is that as far as your subconscious mind is concerned, it's really not a big deal to override that habit. Because the conscious mind can't stop smoking. That's what cold turkey is. That's why people have such difficult reactions to cold turkey, but it's the subconscious mind that takes us, of course, to another place. So that was really interesting for me early on, and then working with pain management, and you were talking about the hypnotic phenomena of anesthesia and analgesia, and really amazing with pain management, and then doing some hypnobirthing. I remember a woman saying that her baby just flipped right out. We did 4 or 5 sessions, and I tried that. That was my first or second hypnobirthing patient, and I was frankly surprised, but I didn't let her know that. But I was really pleased that it worked. And one thing about an Ericksonian approach, what I learned from the great teachers and mentors I've had, John and Janet Edgett and Jeff Zowag and Bill O'Hanlon, is, and they don't explicitly state it, but it's just modeled, and Erickson was the one who modeled it originally, and that's this unwavering belief that your client will achieve their goals, this unwavering belief that they will get better. And that's because everyone has a subconscious mind, and it's incumbent upon the therapist to facilitate a unique creative strategy to get the person where they deserve to be, where they can achieve their goals. So we really don't even deal with the concept of resistance. It's about how do we bypass that and allow the subconscious mind to do what it does and get people better and heal them. Yes.
Absolutely. Joe Dowling, thank you so much for being on my show, for telling us about your new model, Zonefulness. And you're in Philadelphia, so if anybody would like to contact Joe, you see his website at the bottom of his name on the screen, so you can contact him through that. And I'm really hoping that the book is done, is complete, but hopefully it'll be published by the end of this year. It's called Zonefulness, and you can probably get it from, I think that you also have another website which is called Zonefullness, but you can also get it from his website, and I'm sure in Amazon.com as soon as it comes. Any final words to our viewers?
Just that I had a great time, and thank you for inviting me, and I really enjoyed myself.
Wonderful. Thank you for being with us. And for all of you, thank you for being with us. And until another show, create a wonderful day, week, year, life. Bye-bye.